Have you ever noticed someone's skin or eyes turning yellow and wondering what is really going on? It's a liver problem or something in the blood or maybe the bile duct. I'm Dr. Motahare, and in this episode, we are going to talk about jaundice, what it truly means, what are differential diagnoses, and how doctors investigate it. By the end of this session, you'll discover why jaundice isn't a disease itself, but it's a warning sign that something is happening deeper. Let's dive in. Jaundice, or what doctors call icterus, means yellow discoloration of the skin, eyes, the white part of the eyes, which is called sclera, and sometimes inside the mouth. This happens when a yellow substance called bilirubin builds up in the blood. Usually bilirubin level should be above 3 milligrams per deciliter before we can see that tint yellow color. Jaundice itself is not a disease. It's a visible clue that something is affecting the liver, the bile ducts, or red blood cells. To understand jaundice, we need to know where this bilirubin comes from. When old red blood cells are broken down, they release a component called heme, which turns into bilirubin. At first, this bilirubin is not water soluble, so it travels to the liver attached to a protein called albumin. Inside the liver, it converts into the soluble form that is called conjugation. Then the liver sends these substances to the bile, which goes into the intestines and gives a stool its brown color. If anything interrupts this pathway, whether before liver, inside liver, or after liver, bilirubin can build up and cause jaundice. We have two types of classification for jaundice. One of them is based on where the problem occurs, pre-hepatic or before the liver, usually when too many red blood cells are being broken down due to different reasons that I will talk about. Hepatic or inside the liver, where the liver cells themselves are sick or damaged. And post-hepatic or after the liver, when something blocked the flow of the bile, like a gallstone or tumor. And also the other classification is based on the type of high bilirubin. Is it conjugated or unconjugated? Unconjugated, it's called indirect bilirubinemia, and conjugated means direct bilirubinemia. And based on the features, they are completely different. Let's start with indirect or unconjugated type. This happens when bilirubin builds up before it reaches the liver, either because too much is being produced or because the liver cannot process it efficiently. For example, in certain blood disorders like sickle cell disease or thalassemia, red blood cells break down too quickly, flooding the system with bilirubin. It's more than the liver capacity to conjugate it. Or sometimes there are some mild and sometimes severe inherited disorders that the liver enzyme works a bit slower or has some problems. Most of the time, this kind of inherited disorders are harmless, like Gilbert syndrome, and often just found accidentally. And there are also some more serious forms too. In these cases, the urine stays normal in color because this form of bilirubin is not water soluble, so cannot be transmit to the urine. It's attached to the albumin, and this complex is a big one. It cannot excrete in the urine. So the urine color is normal in this situation. Next, we have direct or conjugated jaundice. This means that bilirubin is processed by the liver, but cannot flow out properly. This can happen if the liver cells are inflamed, as in viral or alcoholic hepatitis, or injured by medication. Or it can also happen if bile ducts are blocked, for instance by gallstones or tumor or scarring. When bile flow is blocked, bilirubin seeps into the blood and shows up in the urine, making it dark brown, while stool becomes pale or clay colored. So in direct or conjugated icterus jaundice, the urine will be dark yellow, brown, and also the stool will be pale. People also may feel itchy, tired, or lose their appetite. That all just point to the problem of cholestasis or bile flow blockage. Here is a quick summary. If bilirubin is unconjugated, think of red blood cells problems or some liver enzyme issues like Gilbert syndrome. If it's conjugated, think of liver inflammation or bile duct blockage. And sometimes both can happen together, which we call it mixed pattern, as in viral hepatitis or drug-induced liver injury. So the type of bilirubin helps guide the next step in diagnosis. When a doctor sees a patient with jaundice, they start the complete history and examination. They will ask about when it started, is there any associated abdominal pain, or any alarming signs such as weight loss, unintentional weight loss, or fever, or itching, or urine and stool color changes, or loss of appetite, based on the things that doctor can consider about differential diagnosis. Then they should go through some blood tests to check for bilirubin level, liver enzymes, and clues for infection or anemia. A urine test can show whether bilirubin is appearing in the urine, which means it's conjugated type. Imaging like ultrasound helps see of bile ducts and also liver, and can help us to understand if there is any kind of blockage in the bile flow to the intestine. If all the things cannot work, we can use some more advanced technologies such as MRCP and liver biopsy in order to understand what is going on in the liver. After we understand its direct jaundice or indirect jaundice, we will go through some more steps. For example, if it looks like pre-liver problem, we test for anemia, red cell destruction, using blood smears, enzyme tests, sometimes reticulocyte count, complete approach to hemolytic anemia to find out if there is any reason for hemolytic anemia and also any sign of hemolytic anemia. If we think there is something wrong in the liver, if we are thinking about viral infections like hepatitis B or C, we will ask for a certain test. Sometimes we are thinking about autoimmune hepatitis or metabolic disease like Wilson disease or hemochromatosis. We will ask specific tests for each one. If we suspect a blockage in the bile flow, we will use ultrasound, MRI, or ERCP to visualize the bile ducts. Each of these categories also has many other tests in the following steps. But these are the first ones. Here are some practical clues doctors use. If bilirubin is found in the urine, it means that it's conjugated and water soluble. So the problem is after liver. If the urine is dark like tea and the stool are pale, think bile obstruction or a kind of hepatitis. If liver enzymes like alkaline phosphatase and gamma GT are higher than liver-specific enzymes such as ALT and AST, it points toward a blockage in the bile flow. But if ALT and AST are much more higher than alkaline phosphatase and GGT, we will think about liver injury, a kind of hepatitis, viral, autoimmune, medication-related, or any kind of metabolic disorder, Wilson, hemochromatosis, and many others. And remember, while most of the jaundice point toward something at least a little serious in the body, some of the mild jaundice is not important. It's just a kind of very mild inherited disorder, which is called Gilbert syndrome, which is also more evident when the patient is hungry and overstressed and will disappear in the calm and also full patient. Let's summarize. Jaundice is a sign, not a disease. It tells us something is wrong. We should find it in the liver or in the blood. Doctor first determine it's indirect or direct bilirubin that's high. This will guide us through the next steps. They use a structured process starting with history, complete history, physical examination, lab test, imaging, and further to find the cause. Early evaluation is key because some causes like obstructions or hepatitis or hemolytic anemias may need urgent treatment. And while sometimes are mild and harmless, others can point to really serious illness. So never ignore yellowish of the eyes or skin. Thank you so much for watching. I hope this video helped you understand jaundice in a simple but clear way. If you find it helpful, please like, share, and subscribe to this channel. Your support helps me create more educational videos on health and medication. See you in the next video.